Hi, I'm Jason Rentschler, the COO of Wesley Community and Health Centers in Phoenix. Today, we're going to talk about how Wesley used robotic process automation to increase visibility into our operations. This has enabled us to become more responsive to our patient needs, increase our appointment volume, improve our patient mix, and increase overall profitability. Wesley has three campuses serving about 7,000 patients per year. Over 70% of our patients are uninsured. I've been at Wesley for a little over a year and a half. Before that, I was in compliance and quality improvement since about 2008, including a little bit over a year at Access. I've been focused on systems and efficiency, and I like to bring that perspective to my work in the CHC world.
Hi, I'm Theo Kipnis. I'm a commercialization strategist at Trumpet. We are based in Chandler, Arizona, and we've been automating business processes for 22 years. I've been talking with Arizona CHCs and learning from you about your process challenges for about the last year and a half. I am excited about the many important ways that automation can help you serve your patients and improve operations.
So in the spring of 2020, we were looking ahead to the improvements we wanted to target for the year. We knew that certain things were important, like improving provider utilization, reducing time to the next patient or the next visit for patients, and then ensuring that we were meeting all of HRSA's requirements. But in many ways, we were flying blind in determining what specific changes to make because getting reports out of our data systems was such a cumbersome manual process. We had Power BI, but it wasn't that useful, especially if it takes hours of manual work to get the data out of the systems and into Power BI. And until we gained visibility into our data, we weren't going to be confident in our decisions. We also knew we were missing out on a lot of revenue. We were only capturing about 5% of the $600,000 worth of incentives available through our payer contracts because of our quality targets. We weren't necessarily hitting them, and we were having some other reporting challenges.
So Jason told us that he and the other members of Wesley's leadership team were spending a combined 40 hours per week running reports in 5 different systems. The combined value of their time was about $85,000 per year. There were 3 people primarily involved in collecting this data, and all that time spent gathering the raw information cut into the time that they needed to analyze what was happening and decide what to change and then put changes into effect. And it took so long to run the reports that they couldn't run them every day. So by the time they got the data to look at, some of it was out of date. And there were many other reports that they would have run if they could, but everyone available was already maxed out. To solve this problem, Wesley had allocated funds to add a data analyst to do this work instead. And that would have given back the leadership team their 40 hours per week for analysis and decisions, but it also would have cost an estimated additional $85,000 per year to hire this person. And the data analyst wouldn't have been able to do any more than the team was doing already. There are only so many reports that a person can run in a day. So all the reports that Wesley's team had no time to run to find new information about what they should change was going to stay untouched. Wesley's challenges were a perfect fit for robotic process automation. RPA is software that can be programmed to execute any repetitive process on a computer. So instead of using up staff time on repetitive work, RPA can be taught the same steps to complete a workflow, and then it operates software just like a person does. RPA can open programs, select menus, search for records, enter data, read documents, use branching logic, and more. But it works many times faster than a person without typos or missing steps. So to help solve Wesley's problem, Trumpet programmed an RPA bot to run all of Wesley's reports every night and save the files to a designated place from which Power BI could read them or employees could access them. So what you're seeing here is a time-elapsed video capture of the bot running all the reports that Wesley's team used to have to run on a busy day. Taking a closer look, Wesley's team needed to run reports daily, weekly, and monthly out of 5 different systems and import them into Power BI. 3 different eClinicalWorks EHR modules, Wesley's HR software Insperity, their VoIP phone system Crescendo, QuickBooks, which doesn't produce native reports that Power BI can use, so those needed to be manually formatted before they could be imported, and Azara, for quality measures data. These programs don't provide ways to schedule their reports to run automatically, so a person had to sit and run each report every time. It was awful, but that's a perfect job for a bot. Each of these reports can take several minutes to run. Some can take up to an hour. The whole process you're watching now shows the bot running reports for about 45 minutes with no manual intervention needed from Wesley's team. And because we optimized the process before we automated it, when the bot is running for 5 to 45 minutes per night, it accomplishes what the team used to do in a combined 8 hours per day or 40 hours per week. Trumpet's RPA process runs every scheduled report overnight, feeding Power BI dashboards that are up to date every morning.
We now have over 30 dashboards showing up-to-date information about our operations, our COVID response, our UDS data, and our call center activity. Having this information has made it a night and day difference. And the way that the automation was built, we can add new reports to it whenever we want. So we're always increasing the work that the bot is doing, which gives us new insights while saving staff time. We actually have over 100 reports running through this process now. The best part is that we now have the time to use the data to identify the problems and try to fix our processes. One of the first dashboards we created was for our COVID-19 response. It helped us decide very quickly to start limiting in-person programs for the safety of our patients and our staff. This was mid-October, so statewide numbers had been going down, but now I hit the refresh button and we saw that our positivity had shot back up in our areas. We realized that with the new numbers, we couldn't have people coming in that weren't patients. We ran a lot of programs at our community center that are important to us and important to the community, but we couldn't risk increasing the spread of the disease. We, the leadership team at Wesley, needed to see data on this before suspending our programs. Making this decision in the past would have been hard, but now all we had to do was click a button and say, 3 weeks ago, our positivity rate was down to 5%. Now we're at 18%. We were starting to make same day decisions because we had the data to back them up. We had heard that it was hard for patients to get through to us by phone, but we hadn't been able to quantify the problem before. We created a call center dashboard and saw that our call abandonment rate was really high, around 22%. We'd like it to be in the low single digits. Digging deeper, we saw that our call times were also really high at around 15 minutes per call. We brought in a consultant to find out why. She found ways to shorten the call cadence and retrained our staff. That helped, and before long, the staff's average call time was down by 80% to under 3 minutes, and our call abandonment rate went down to 6 or 7%. We were working to get it down further, but then every week our call volume kept growing. Between people looking for COVID testing and others looking for care they'd been putting off during the pandemic, our daily calls climbed from about 250 calls per day to over 500 a day. Through the dashboard, we could see it happening. And even with our shorter call times, the call volume was more than our staff could handle, and our abandonment rate was now up to around 50%. So we added another 2.5 FTEs to the call center team and nearly tripled our incoming call capacity. Before long, our call abandonment rate had dropped again. It's still a little bit higher than ideal at about 18%, but it's much better than the peak of 50%. And with all these calls, we were serving far more patients. Best of all, now we can see the data. When we have challenges, we can see where they are or what they are. We can look at what changes to make and support those decisions. We can also see the impact of these changes on our patient mix. Patients with insurance know they have options and they won't wait for us to pick up the phone. By making it easier to schedule an appointment, we're attracting more patients who have insurance. In Q4 of 2014, we had about 35% insured visits. In Q4 of 2020, after the implementation, we were at about 37.5%. Looking at Q1 of this year, we were over 40% insured visits. We've gone from just under 35 to over 40% insured visits. We've increased insured patient visits by about 16% since we've made these changes. Those visits are more profitable for us. So for the first time in a while, we were able to bonus our staff with a one-time pay increase this year. If these numbers stay up, maybe we can keep doing things like that. Another important point is that those insured patients are also our attributed patients. One more important factor for us in getting our quality measures up is to make sure that all of our attributed patients are coming in to see us. With more of this happening, as we're seeing now, we're on the right path to increasing our VBC incentives. The automation is also giving me the ability to look at our workflows and assess whether they're effective. For example, we discovered a gap in our referral process. We noticed that our referral numbers were really low, but digging further, we also noticed that our telephone encounters seemed to really high. Our average days to schedule a referral were also well above what we wanted them to be. We went through our provider workflows and found that there was a box they weren't clicking in our EHR to alert our referral coordinator that the patient visit resulted in a referral. Once we retrained our providers, we saw a difference. Now you can see that between the 6 months before we had the automation and the 6 months since that implementation, our referrals have gone up from 1,800 to over 2,500 for the period. So those handoffs are now happening. What's more, our average days to schedule has dropped from 11 and a half days to about 3.5. That's a 70% decrease. We see that the most in our routine visits. So we need to work on decreasing scheduling times for our urgent and stat visits. But we can see over here on the left which types of referrals are taking the longest to schedule, so that gives us specific things to work on. Overall, this is going to give us better health outcomes. Patients are going to be able to be seen by their provider sooner, and they're going to get better a lot faster. And we'll keep using our data this way to find other process gaps and fix them and keep improving our metrics. The whole idea behind the automation was to help us improve our outcomes and our performance measures overall, not just internally, but with our health plan partners to increase our eligibility for their performance incentives. After coming on board, I determined that Wesley had been leaving close to $600,000 a year on the table. We hadn't been meeting our performance targets. A big reason for that is our team members didn't have access to data where our gaps were. Now we can see where we stand without taking the time to run reports in Azara or our EHR. The data we get from Azara is great, but it isn't always organized the way we need it. It also takes time to go in and run each report, and not everyone in the organization has access to that system. Now that the bot runs all of our reports at night, everyone can see which measures we're hitting, even without access to Azara or Power BI. Here's a spreadsheet showing our quality measures data that I can make available every morning to anyone in our organization. Because we're no longer waiting to get this information from our plans, we can be proactive in meeting their targets. As a target, we think we can increase our capture of VBC incentives from 5% to hopefully 75% in the next 1 to 2 years. From here, we need to add some additional dashboards for social determinants of health, clinical data, a provider scorecard, service utilization, and even scheduling. This is going to help us get up to 80 visits per day with our providers and target other operational changes. We're also looking at the possibility of running new reports and new systems like our new compliatric platform, our Aunt Bertha system, and using RPA for things like insurance verification, or to even generate letters automatically to reach out to patients about gaps in care. We've really achieved everything that we had hoped for through this automation, namely greater visibility and the executive time to use that visibility to make decisions. We've made important changes that have increased our quality of care. We've even found new ways to save 40 additional hours per week of staff time by running new reports. And we've redirected that to COVID testing. Our increased capture of VBC incentives is in progress, and it's going in the right direction. The ROI is very promising. Between our executive time and additional staff time saved, that's $120,000 per year redirected to other work. If we hit the VBC targets we have in mind, that will be worth an additional $400,000 per year. All of that represents something like a 4 to 18 times ROI on this project. That's not even counting the additional revenue coming in from increased patient visits. Thank you for watching our presentation. If you'd like to reach out to either of us about this experience or automation in general, please feel free.
Jason may be the only FQHC COO in the country to have leveraged RPA and Power BI to gain visibility into operations. So he is going to be a great resource for ideas about how this approach can benefit your center. I, of course, am always interested in talking through how automation can help us CHC. So please feel free to reach out to either of us for details or reach out to me for details on what makes the process a good fit for automation.
And of course, we'd love to hear your questions and feedback. Thanks again for watching and have a great day.
Thank you.
Thank you.